Play therapy, a little bit about its history, and a whole lot more. Today we'll talk a little bit about what play therapy is, its history over the past 100 years, the intended population for play therapy. It's not just for children anymore. Some stress and stressors in children, the play therapy room, the toys you might find in preparing for a child's first visit, systematic approaches to play therapy, and important takeaways, things to remember, and some resources. So let's begin. Play therapy. What is it? Play is one of our most fundamental activities. Plato said it is the essential nature of man to play. In fact, play is one element that makes up most, if not all, of our childhood memories. What we know in terms of development about children is that their language does not keep pace with their cognitive development. Play is the language of children. It's how they communicate. Adults will use words to communicate, but play is a child's way of communicating with adults. Mostly, children are not able to articulate feeling words or actual words to adequately express what they may be experiencing. Through play, they can actually give you insight into what is really happening with them. So let's take a minute to look at the history. For centuries, researchers have observed play and its obvious benefits. For the past 100 years, mental health professionals have applied the healing powers of play into a form of counseling or psychotherapy with an evidence-based research called play therapy. In the early 1900s, the most popular form of child psychotherapy started in England with the psychodynamic therapist. This thrived in the 1920s and 30s. And in 1930, a popular assessment tool called the Drawman was developed to analyze the drawings of children. This was a way to see that children are communicating and expressing themselves. In the United States, in the 1960s, humanistic play therapy came into vogue. This was the predominant form of psychotherapy in the United States. Through the 60s and then into the 70s, other forms of child therapy became popular, such as cognitive behavior therapy. At this time, the use of play therapy dwindled and fell through the cracks. In the 1980s, the idea that the main therapeutic power of play came back to life. So now we're going to talk a little bit about the intended populations for play therapy. Play therapy has traditionally been seen as an approach for young children, those 3 to 6 years old. However, we know that people of all ages play. Play therapists are integrating sessions involving play with people of all ages. Although play therapy is a form of therapy primarily geared towards children, it can also be used to treat issues faced by teenagers and adults. By adulthood, most people have lost their ability to playfully explore themselves. Play therapists are trained to help adolescents, adults, and even the elderly relearn the values of play. A growing number of organizations and experts are dedicated to play research and advocacy, believing that play is important for people of all ages. Adults and children engage in therapeutic alliances that focus on play have an opportunity to choose from a variety of modalities. Again, while most clients are children, play therapy can also help older clients, especially those who have difficulty verbally expressing themselves. So now we're going to talk a little bit about stress and stressors in children, and you'll see some statistics come up in just a second. So the main question here is, what is stress? Stress is an emotional experience that is accompanied by predictable biochemical, physiological, and behavioral changes. When we encounter a stressful event, our bodies produce a primal physiological response that is necessary to human survival. Here we see some common stressors in children. So when these chemicals signals the body to increase our heart rate, our blood pressure, our breathing rate, and our muscle tone, stored sugar is released in the blood, providing needed energy. There is an increase in vigilance or awareness of important information, and a decreased focus on non-critical information. And right here, we want to examine some of the statistics that we have about common stressors. Almost 19% of adults experience some sort of mental illness. 1 out of every 10 Americans are addicted to drugs or alcohol. Almost 3.5 million referrals of child abuse and neglect happened in the United States in 2012. Almost 15% of Americans live below the poverty line. Based on these national statistics, what percentage of U.S. children do you think live under chronic stress? Okay, now think about this. Based on these national statistics and your knowledge of the students in your school, what percentage of your students do you think live under chronic stress? So now we're going to talk a little bit about the play therapy room, the selection of toys, and preparing for the first visit. The counselor's main objective is to use play to prevent problems, such as those listed in the previous slides, from escalating. Ideally, counselors use play therapy early in their therapeutic relationship with clients to help to resolve problems. More recently, there is a trend to make parents partners in treatment. Studies have shown much higher improvements when parents partner in the play therapy treatment. This type of intervention is known as parent-child interaction therapy. To foster play, therapists often stock a portion of their offices with therapeutic toys or maintain them in a separate playroom. The playroom during the counseling experience is a safe place for children where they have the freedom to express their emotional lives and to be understood by the therapist who recognizes the healing power of play. Toys are a means by which children express themselves. The selection of these toys are used to facilitate the expressions. Examples of toys utilized in play therapy would include dolls and dollhouses, castles, swords, pirate ships, animal figures, puppets, sand, and various art supplies. Sand tray therapy involves the use of a tray filled with sand. Within the tray, children use a variety of miniature figures to build scenes or express feelings. This is a powerful way for children to explore their emotions and to make connections. The use of art therapy and other expressive arts can also help children recognize dynamics, discover emotions, and find solutions creatively. Each of these therapies help children address a wide variety of challenges such as anxiety, low self-esteem, peer relationships, acting out, processing past events, and adjusting to life transitions. Play therapists carefully prepare for each client's first visit to their playrooms. A child walks in and they look around the room. Since the relationship hasn't started yet, often this time is called a safe play. The emotional disturbance or the purpose of the child being there is not being acted out quite yet. The therapist is starting to connect with the child, and they're getting a sense of the therapist and who the therapist is, and also if the therapist is perceived as safe. Children will go where they want to go within the play area. Just as with any other kind of client, a counselor needs to build a relationship with this client. This is especially important with children because they need to learn to trust the counselor. The counselor is a new person for the first-time client. Once the child feels safe in the counseling relationship, the play therapist is able to help the child use play to make sense of their troublesome life experiences or issues that need interventions. This is accomplished by using toys and expressive activities. The play therapist and the child are able to better understand, identify, and try to resolve a wide range of social, emotional, behavioral, and other developmental issues. We're going to talk a little bit about systematic approaches and the therapeutic powers of play here. There are a lot of different kinds of play therapy, but there are certain things that link each of them together. Now, there are counselors who say that they use play therapy, but they do not use a systematic theoretical model. If a counselor is going to have success and have a level of quality care and ethical, responsible care to the children they are working with, there must be a systematic theoretical model that the counselor is basing what they are doing and when they are doing it. Play therapy originated from what some of those theoretical underpinnings are. Child-centered play therapy is where the counselor does not need to direct children about what to play with or how to play. The child knows how to heal themselves. Books are tailored to the age and the developmental needs of the child. Books that are relating to issues such as sharing, kindness, making friends, school, etc. are important to have available. Researchers refer to the active ingredients in play that produce change, and they are a basic change mechanism that lead to healing. There are upwards of 25 to 30 specific therapeutic powers of play. Some of the more basic ones being communication. Play fosters awareness, such as communication and self-expression, particularly in kids who don't have the words to express themselves. Play therapy opens the door to the unconscious through the use of symbols and metaphors. It enhances relationships. There's a whole school of play therapy called relationship play therapy. Play therapy allows us to teach new skills and knowledge to children. If a technique is available to be made fun and enjoyable, clients are going to learn the skills or strategies better and emotional regulation will be promoted for individual clients. This has the potential to lead to self-actualizing power. For a particular client, the most important therapeutic power of play would be the one that's healing for that person. One technique or one approach is not going to be effective across the board. There are too many diverse problems that clients present with, too many complex problems. One size does not fit all. There is a need to develop a range of interventions, some non-directive, some more structured and directive, in order to be effective. Most importantly, the counselor would have to do first is establish rapport, and that's to develop a mutual liking between the client and the counselor. That's where play is important, particularly with kids. If they see you having fun and being a fun and playful person, it's much easier to establish that rapport. So, some important things to remember and also some resources. One might wonder, what exactly is play therapy? While adults use words to communicate, children express themselves, process feelings, and find solutions through play and a creative expression. Play therapy uses puppets, dress-up, games, and imaginary play to help children communicate. Through play therapy, children are able to disclose information, process emotions, and find solutions to their struggles while being encouraged and supported by a counselor. Play therapy is a model of therapeutic intervention that use with children that helps them to deepen their communication skills in a therapy situation. This allows them to more clearly express their needs, their wants, their wishes, and their feelings in a way that's developmentally appropriate for them. Play therapy is a valuable, credible, professional, therapeutic discipline that is developmentally sensitive in meeting the client's needs. This is especially if the client is a young child, as a young child's natural way of communicating is play, which is the premise of play therapy. Play therapy works essentially because it's a natural thing for a child to pick up toys. Toys are their words, and play is a child's language. Playing helps children to process emotions and feelings. Children grow and learn about themselves. They begin to understand that they can't change their life story, but they can change their view about themselves within their own story and gain some personal power. The play therapist of the future, having a repertoire of therapeutic interventions, is important. In other words, the play therapist must be skilled and competent in more than one approach. Again, one size does not fit all. The play therapist needs to combine interventions in some cases because their clients are so complex. Over here on this side, you'll see some helpful links. And these links go to just things that we found valuable as we were doing our research. So thank you very much for listening to our presentation.